ladies and gentlemen, and our fellow doctors. Welcome to episode 24 of Decoding AI in Healthcare series. I'm Hetvi Shah, your host, and I'm thrilled to have you all join us today for a deep dive into a discussion that will revolve around the role of AI in healthcare within Indian context, exploring its current applications, ethical considerations, and future potential. We aim to provide comprehensive view of where India stands and where we are headed towards. And today, we are honored to have with us distinguished experts who bring diverse perspectives and profound expertise to this discussion. And it gives me immense pleasure to introduce them all. So firstly, allow me to introduce to Dr. Jothydev Kesavdev, who is the CEO and founder of Jothydev Diabetes Research Center in Kerala. Doctor is a pioneering diabetologist with numerous national and international presentations and publications to his name. He was the first speaker from Kerala at the American Diabetes Association and International Diabetes Federation. Dr. Jothydev is in the forefront of diabetes care and telemedicine. His innovative approach, including the diabetes telemanagement system, has set a new standard in patient follow-up and comprehensive diabetes management. So welcome, Dr. Jothydev, and we are so honored to have you today.
Thank you very much. I am also honored to be part of this. Thank you. Thank you, Hedvi.
Next, we have Dr. Amit Kumar De, a visionary in medical innovation and AI entrepreneurship. He's also the founder of Doctor's AI Club. Dr. Amit's work bridges the gap between technology and healthcare, offering groundbreaking insights into the integration of AI in clinical settings and the essential data elements for AI success. So welcome, Dr. Amit.
Thank you very much, Hetvi, for the kind introduction. It's such an honor to have Dr. Jothydev Kesavdev with us today. And very soon we will also be joined by Dr. Shashank Joshi. So, dear friends, a warm welcome to everyone at the 24th episode of MedAI podcast, Decoding AI in Healthcare. And today I've got two very interesting guests. And one of them is right on the screen, Dr. Jothydev Kesavdev, a mentor to many of us, a guide, I would say a lighting guide. And he is also commonly known as the diabetes technology man of India. So a warm welcome to sir on this MedAI podcast. Welcome, Dr. Jothydev.
Thank you. Thank you, Dr. Amit. And I am so happy that you are doing this program. And you are known as a person who has got so much of passion and interest for artificial intelligence. And this I have probably discovered the moment I met you. And that was a few years back. And I'm really honored that you have invited me along with Professor Padma Shri Dr. Shashank Joshi. He'll be joining very soon. He's busy in his hospital with some emergency patients.
Yes.
And let me also take this opportunity to congratulate you for your seminal works in artificial intelligence in India. Thank you.
Thank you. Thank you very much for the kind words and for all the encouragements and for all the guidance. So I'll go straight into the topic, and we've had a lot of hype about this episode. A lot of questions also came in from many of our peer groups from the diabetes community. So with AI around us and with AI evolving, Dr. Jothydev, how do you see the adoption of AI into the field of diabetes care, especially if we are focusing on chronic disease management? How do you see that happening now, and how do you see that evolve maybe in the next 5 years?
Dr. Amit, that is a very good question. And this is a question which is very often discussed and debated. How will AI change the scenario of healthcare in India? So I would like to compare AI with internet. So when internet was launched around 3 decades ago, it was slow in the beginning. And then after 5 to 6 years, rapidly it started penetrating, and it was so fast. And it was so fast, and it completely transformed the lives of every person in the country. And knowingly or unknowingly, all of us are now using the power of AI in our smartphones or in our automobiles, knowingly or unknowingly. So it is already there existing. And I might say that AI is not only transformative. In the next 5 to 10 years from now, you should be knowing much better than me as an AI-driven personality. I call you as an AI-driven personality. And you are so into those innovations, and you will totally agree with me that in the next 5 to 10 years, our healthcare scenario, the way we manage patients, way we treat diabetes, the outcomes will be totally different. It will be totally different. And that will be with the power of artificial intelligence. And artificial intelligence, similar to any technologies, it is rapidly transforming. So if we are discussing something tonight, the scenario might be totally different after 1 month. So that is the speed by which it is advancing. And the same speed, I will say, will be reflected on diabetes care, diagnosis, prediction, and in so many other phases of diabetes care and in health.
So AI is not new, and we keep saying this in most of our discussions and podcast sessions. There has been a big role that machine learning has been playing for more than 2 decades, I would say. And then there was deep learning, and deep learning is widely used, and maybe we are using it in the field of diabetes care as well. And we had suddenly seen a surge use of AI and talk about AI, discussions about AI with the introduction of generative AI, especially in the open forum platform, where everyone, whether a healthcare provider or a patient or a service provider, had access to the use of conversational AI and generative AI. So now if you look at diabetes care, Dr. Jothydev, as the diabetes technology man of India, you have been pioneering the use of technology in insulin pumps in the form of continuous glucose monitoring system, not just now, but for more than a decade or more. You have been advocating the use of that. So how do you see those technology aspects evolving with the use and incorporation of AI today? So how do you see AI come into diabetes care, especially in the context of retinopathy screening, in the context of insulin pumps, or maybe in continuous glucose monitoring system?
Yeah, I agree, Dr. Amit. And I have been using technologies in diabetes care for more than 26 to 27 years now.
Yeah.
And the first technology that I started using was telemedicine, then creating our own electronic medical records, and then continuous glucose monitoring and insulin pumps in 2004. But when you compare the advancements of technologies in the last 10 years with the, and if you compare with the last more than 50 years, the advancements in the last 5 to 10 years have been phenomenal. And it was incredible. So in diabetes, probably we started using AI unknowingly, maybe in our mobile phones, in our mobile health applications such as in the iPhone. I routinely, those patients who are on an Apple Watch or on an Apple mobile phone, I will go through the mHealth applications to monitor their physical activity, their sleep pattern, the duration of sleep, their resting heart rate, and so on. And that is thanks to artificial intelligence. But when you consider the continuous glucose monitoring devices, now we are completely dependent on the traditional algorithms for predicting the glucose levels. Since we are measuring it from the interstitial glucose, there is always a difference from the blood glucose levels. And for the automated insulin delivery devices, we are having the conventional algorithms such as the model predictive control, the proportional integral derivative. And the one which is most popular in India, 780G, it makes use of PID. Whereas the most popular Omnipod, that is a patch pump, it makes use of model predictive control. Whereas the recent studies have shown that when you are using the artificial intelligence and the deep learning, as you said, and the machine learning algorithms, the new, so it can incorporate multiple layers of neural network. And this is the next advancements in neural network artificial pancreas. That is neural net artificial pancreas, where a recent study incorporating a University of Virginia MPC algorithm compared against the traditional MPC, it has shown that the time in range, above range and below range are almost the same. So these two modalities have provided equivalent results. And as everyone knows, more data sets when it is provided for training, and when it is trained with vast data sets, it keeps on improving. And that is the beauty of artificial intelligence. So if you are reaching a TR of more than 75% with AI now, after a month, it will be more than 95%. And that also with 6 times less computational demands. So when you're incorporating AI in some of the already existing devices, my hope is it is going to be less cumbersome and definitely going to be less expensive. Now, nobody can afford these devices. And very soon we will have CGM with prediction. Some of the CGMs were already there with prediction, such as from Medtronic, but there'll be algorithm based, and these are the AI data-driven algorithms, which can predict more precisely in some of the future. And the one which is upcoming very soon will be from the family of Roche. And I will say that the biggest barrier in diabetes is large data sets, big data analysis. Because our practice of diabetology for you, me, and for Shashank ji, it is based on more than 100 or 200 numbers, A1C, and whatever be the device. It can be a body composition analyzer, it can be a weighing machine, it can be a connected glucose meter, it can be a connected CGM. So everywhere you are making decisions based on numbers. So with large language models, LLM, replacing the conventional AI, if you can interpret this text, images, and the multiple data sets and provide you the text-based outputs, that is the future. That is the future we are waiting for. And I know that you are already into some of these. Amadei is creating some of these similar platforms. And we are looking forward to an era very soon in the future where AI will fill the gaps. So now there are more than 50 gaps in diabetes. And this is the reason why, despite all those innovations, despite all those GLP-1 receptor analogs, the dual, triple, despite all of these innovations, the A1C remains the same. And with the vast majority of patients with diabetes succumbing to the complications. So AI, I believe, can fill in the gaps. Now, 10% of the population is having diabetes worldwide. And these numbers are huge. And doctors cannot, probably as simple human beings, we cannot manage this. And the error is human. And AI can also make some errors. And that is where the humans will have a major role. And our role, I know that is going to be the next question from many of our audience as well. And our role, because I also remember you telling me, the role of doctors will become probably more responsible. And we'll be more focused in where we are really required. So I am very, very positive about the future.
I'm going to take out two very important quotations out of this whole point that you made. And one is, you spoke about the PID algorithms, the control theory, that's what it's based on, the insulin pumps. And we are going into the era where we will be having a layer of machine learning or neural networks, deep learning neural networks over and above these control theories. So practically it is going to do is that it is going to add a layer of real-time series prediction. And that's how it is going to bring more and more improvement, personalized improvement in the time in range that you're talking about. From 75%, it will push it up to 90%. And I think that would be fantastic. The second important point that I will take out from what you said is that it has to bring down the cost. And it is so very important that the whole essence of having technology or AI or both, the success of it depends only if it is accessible, affordable, and available at a affordable cost. So that is so very important. So I think these are the two very important points I will take out from the visions you shared. I would like to ask one more point, since we are talking about diabetes care and the use of AI in it. we've always felt that a lot of the challenges and the 50 need gaps that you just spoke about can be solved by diabetes self-management education. And we've been always propagating diabetes self-management education, especially because it's a chronic disease, it's a metabolic disease, it's a lifestyle disease. Do you see there is a role of generative AI, specifically if I can mention conversational generative AI, a chatbot based human versus machine interaction using natural language processing, fill this gap of diabetes self management education in patients and provide a broader spectrum of better glycemic control in our patient?
Yeah, of course, I am very positive about this development. And I know that so many things are happening. Developments are happening in natural language processing. And now the machines can recognize, the AI algorithms are now capable of recognizing the speech, the text, the image. And of course, they can chat like a human being. They can not only think and behave, they can even interpret and generate new ideas like a human being. So that much we have grown. Because I believe that there are a couple of P's where the AI will have a role in diabetes. Because our dream of diabetes in the future, filling the gaps, will be personalization. So when you are using diabetes education for a person, personalization is important because every person requires a different modality for education and for training. For somebody, it should be for weight reduction. For another person, it should be for injection techniques. For another person, he requires training and reinforcement for exercise or physical activity. And AA should be penetrative. It should penetrate in all the levels in diabetes care, starting from our electronic medical records. And then of course, precision diabetology, which is emerging where AI will have a major role. And then I would say that AI will have a role, as you said, predictive algorithms, which I am already trying to, along with another firm in our EMR, we are trying for prediction. Because if you have a large data set for many years,
yes,
so it can be used not only for a customized education or for empowerment, it can also be used for predicting even minor complications or the likelihood of developing major complications. So likewise, AI will have a penetration in every level of diabetes care, empowerment, education, prevention, and also from a societal point of view. Even for public health awareness, not only for a personalized diabetes management, even for public health awareness, these chatbots will have a role. That is what I believe.
So very true. I think you spoke about predictive analytics, and I always use this analogy in especially in chronic disease care like diabetes, where we depend upon so much of numbers. We are so used to looking like you're driving a car and you're looking at the windscreen. AI, for the first time, is also going to give us a rear view mirror with your data, and then with that data, like you said, many years of data, and that can have a predictive analytics. It can actually give us a rear view mirror and a rear view analytics, like where was the patient and how it has evolved, how has the medications impacted, what has been the complication so far, and are we doing the right things in the right path? That's what kind of an analytics that AI can help us get. One such example is continuous glucose monitoring, which you just said that for the first time, we have a bird's eye view of the patient's glycemic pattern. And it was not, earlier it was not there. So I think add a layer of AI to that, we are also going to get, a real-time time series predictions coming. And that would add so much of insights, and it would, I would definitely say, empower the clinician to take much better decisions. So with all this, Dr. Jothydev, and I'm so glad to see Dr. Shashank Joshi joining us. I am sure he's come up after a tiring clinic, but I'm sure his AI Abdar helped him out to take care of the patients. So what I was saying, Dr. Jothydev, is with all this around us, how is your experience of implementing, standing today, July 2024, how is your experience of implementing AI into your clinical practice or into something that is bringing a positive impact on your patient care?
I think I said in between that knowingly or unknowingly, we are already using AI in our diabetes care.
Yeah.
And every doctor probably could be using it in preventing, in screening, or in predicting, or in personalized care of their patients. But probably we need to knowingly use it in our practice. And that is where AI is now advancing. So we are using AI in your mobile phone, in your mobile health care applications. But when you look at the doctors at large, when I discussed and when we are doing a survey among the doctors, the commonest reason why the doctors are not using technology is they don't have the time in the clinics, because the clinic is so busy. And if they are incorporating a continuous glucose monitoring, they need to train the patient. And eventually, if the patient is willing, and when they come with the report or when we are having a remote monitoring, with the help of the available digital health tools, then again, it is time consuming. So we need AI to probably overcome this major barrier. So AI probably need to bring down the total time. So this is what I am trying to in my practice. With the help of AI, can AI help me reduce the burden in my practice? Can AI help me reduce the consultation time? Because we need to spend probably 10 minutes more when you're using the existing available technologies, such as a connected glucometer. You have to look at the screen, CD, you have to look at the screen. If the patient is using a 780G, then again, huge number of data. But with the help of an AI, if I am having a conversation with the patient, or if I am having a conversation with my dietitian, as you said, the natural language processing with the help of deep learning and with the help of AI transforming to the new generation with all these capabilities of recognizing the speech, the text, and so on, if it can provide a summary of the recommendations, including the reminders for the patients. My patients will require vaccination, influenza vaccine, pneumococcal vaccine, the conjugate vaccine, the shingles. So huge amount of conversations are required. So we need to explore possibilities how AI can aid our doctors, nurses, and diabetes educators have more meaningful consultations and have everything as recommended by the guidelines. Because if you go by the guideline mediated therapy for any disease, it definitely requires more time. So AI has to help the physicians follow the guidelines with the limited time available. So this is how probably we are all exploring and trying to implement in our practice.
So very true. I mean, empowering the clinician or the diabetologist to deliver the right care at the right point of time to the right patient. I think that's the whole essence of implementing with AI. So, Dr. Jothydev, I'm going to come back to you, but before we take up one question with Dr. Shashank Joshi, we are honored to have you. Hetvi, could you please come back on screen and share the introduction of Dr. Joshi with our audiences?
Yes, thank you. So, Dr. Shashank Joshi is a renowned endocrinologist in Mumbai and president of Indian Academy of Diabetes. Dr. Joshi has an illustrious career with over 1,000 research publications and prestigious awards, including the Padma Shri. He has been instrumental in advancing our understanding of diabetes, obesity, and endocrine disorders, making him a leading voice in the medical fraternity. So we are so honored to have you, Dr. Joshi, and welcome to the podcast today.
Thank you and namaskar.
We're so glad to have you, Dr. Joshi, with us. And I'm going to dive straight into the question. And this is a question that is asked by many to me. And I'm going to put that question to you in a very simple format. We keep talking about AI. Is it really a hype, or there is a reality into it, and we are going to see a transformation of healthcare and clinical practice with AI very, very soon? Or is it just a hype? What's your take on this?
So first of all, Amit ji, I think you have transformed medicinalization of AI. So I think I must compliment and congratulate you and your entire team for generating awareness around people who look after people. which are healthcare professionals, predominantly doctor community. And your question is absolutely correct. Is AI here to stay? Absolutely yes. Is it a part of us in our daily life? Absolutely yes. Because very fact that we and people living with diabetes or pre-diabetes or endocrine disorders, all of us have a mobile phone.
Yes.
Our mobile phone or our computer is our AI today, and that has all the algorithms you can even think of and recognize, and we are using AI in day-to-day life. If you are taking an aircraft and you're going to the airport and you're using a DigiYatra, that is AI. If you are booking a or doing a search using a search engine, and I would not even name a search engine because then we are promoting them, or a social media platform, you're using an AI phone. We are doing this communication podcast with our beautiful team from Synapse, MedI. That's again an AI platform. So AI is here to stay. But when I'm treating people living, and I was just treating people and I had a little time delay because of the traffic jams, AI is helping me in my clinic too. It's a part of my extended arm. Just like we wear spectacles once we are not able to see, I think it is an integral part. Like we wear our clothes, like we wear our spectacles, AI is here to stay in healthcare delivery. What is AI doing? As Jothydev said, it's an enabler. It enables us for communication. So I'll tell you a very simple way. I had a patient who was speaking Telugu. I had a patient who was speaking Assamese.
Yes.
I don't know these languages. My AI through my phone was able to become a translator. And I was able to understand, and they were able to understand what I was speaking. So I used a language which is so, see, India is such a diverse country. Even to make a two-way communication for thyroid and for diabetes from a patient from Assam, because I am not lingua franca fluent in Assamese or in Telugu, so that we could do the communication. And AI became, and a language platform in AI became, again, I'm not going to promote anyone, became a interface for communication. It's as simple as that. Okay, because if you have communication, English has become the vehicle of communication and translation. That space will be now taken by AI. So number one is communication and information exchange on clinical material, information exchange on a disease domain, information exchange on disease diagnosis, information exchange on disease therapy and complications, and screening tools. So I think AI is a part of our lives. It is transformational. It has entered the therapy space too, and it can create a behavioral change also, because it can give us reminders. It can give us, small little nudges. I call them nudges. We should not nag, but it should be a nudge. And these are healthy nudges to make a healthcare transformation. Because ultimately, when we deal chronic diseases, and most of us as endocrinologists or diabetologists deal with chronic disease, a lifelong condition, then actually AI becomes a part of our armamentarium in the delivery model, and it is our extended arm. It is something which is like a solution provider. See, there are two ways to look at life. You can either create a problem or solve it. And I think in a solution, AI is something which is easily available. Why is there still a human being needed? Why is there a doctor or a specialist still needed? Because AI can give us multiple solutions. There is a clutter in the space. To identify from the clutter, which is the diamond which is shining for that particular individual, the human brain is still needed. So AI can never replace a medical doctor. So the first people who are averse to AI, my reassurance to them is that AI is your partner. AI is not your enemy. It is never going to replace a doctor, because to understand AI and apply it for a given individual, a human brain is still necessary. Because human brain will sort what type of a platform, what type of an algorithm, what type of a delivery model will be necessary for that individual. For example, the patient from Assam had a simple thyroid disorder. and just needed a simple medication, but needs a follow-up every 3 months. That has to be understood, and it is easy to do that. All I needed to do is do a tracker there. But a person living with diabetes from Telangana needed insulin, was a type 1 diabetic, was needing automated insulin delivery system, needed a CGM, needed interpretation of lot of data. There was a lot of glycemic variability with peak and valleys. There was a lot of low sugar and high sugar attacks, and needed a more dedicated decluttering mechanism. And AI had to be filtered for multiple solutions and troubleshooting. So it is important to understand that AI is a perfect aid. And I call AI today in healthcare as the modern stethoscope. Okay, we used to use, and doctors are identified with a stethoscope, Amit.
Yes.
So talk for you today is that today's doctor stethoscope is AI.
Yes.
Patient stethoscope is also AI. If he wants healthcare information, he's using AI to garner and interpret that information. But also remember that you should know how to hear the sounds. So heart sounds or respiratory sounds, you must know when to use it and how to use it, and you need to use it efficiently. So I hope I have tried to give you a long story short that yes, AI is here, and we are all using AI every day, day after day. Even if you're not using a platform, even if you're not having digital records, you don't have a system of delivery model, all of us are using it because all of us have a mobile phone with a smartphone.
So very true. I think a very important takeaway from Dr. Joshi's statement is AI is here to stay, and most importantly, it is here to augment the way we practice and we perform our clinical work. So, Dr. Joshi, as a professor, as a mentor, and a guide to many undergraduate and postgraduate students with over many decades of clinical experience, you just shared how you are currently using AI into your diabetes and endocrine practice, like a small example of using like a translator or using it like a scripting summary of the conversation between you and your patient. As also an avid researcher, how do you really see AI transforming medical research, especially in context of Indian healthcare? And also, if you could shed some light on any AI research project that you would be working on that is interesting, that could change the paradigm of diabetes, metabolic, or endocrine care.
So I think your question is very relevant. That AI is here to stay, and in research, see, to do research you need records.
Yeah.
And unfortunately, whether it is private medical space, public medical space, whether it is office practice or hospital practice, record keeping is poor. Hospital practice, it is still there. So only I am told 7% of total healthcare records in India are currently collated and preserved. And 93% of Indians are not maintaining health records.
Yes.
And it is important that the first thing which AI can do is to do research, you need to do record keeping. Once you do appropriate record keeping, then you will be able to study, and do some observations, then do a cohort. And when you can follow up the cohort, you can study the natural history of the disease. So in order to understand research, we do cross-sectional studies, which is a single point study. Then we do follow-up studies. Then we do cohort studies. And when we do serial follow-up studies, then randomize them into 2 parts, do a randomized control trial, which is a higher level of evidence. And then collect all the RCT evidence and put a meta-analysis to it. Each and every engine of research, whether it is an anecdotal observation, which can be scripted on a translator, to the most complex meta-analysis of a randomized clinical trials, all of them AI is an enabler. And therefore, research is huge. In that space, with people from California, Mohammed Jahangir and Terry Spoon, they are the ones who discovered the IoT platform. They put internet inside the mobile phone through Jasper Technologies, and they sold it to Cisco. And then they put that money which they earned from that into Twin Health, where they tried to create a digital twin of the human body in the chronic disease, diabetes, or chronic metabolic space. and they partnered with a PhD from IIT Madras, Dr. Maluk Mohammed. And in this Indo-US collaboration, I got involved and understood AI better in remission space. Now, this is work in progress. We are doing a randomized control trial in which we are taking people living with type 2 diabetes in a control arm and people living with type 2 diabetes in a twin digital arm, in which we are mapping their glucose by CGM, we are mapping their activity by tracker, we are mapping their body composition, we are doing their biochemistry, we are doing their behavioral change, we are studying their sleep, and then through a coach and under medical supervision, trying to create a remission or reversal of a chronic disease model like diabetes. We are in the third year of RCT. We want to continue it for 5 years. The early results are very exciting because the traditional model of remission was that you make 800 calories, which was the Taylor model of remission. And once you take 800 calories for type 2 diabetes for when somebody is young, then you can do diabetes remission. And we are not replicating just in RCT in India, and we have some of the best centers in Bangalore, but we are also replicating this RCT at the Cleveland Clinic in the United States. With Kevin Pentaloon is the PI there, and we have published some of this data, whether it is in the fatty liver space, insulin resistance space, diabetes space. But this is work in progress. This is just an example. This is just an illustration that you can create a digital twin and actually correct human metabolism at a cellular level, and we can look at remission. Because look at the health economic.
I think he is somewhat disconnected, Dr. Jothydev. But that's a fantastic work in progress, which Dr. Joshi was mentioning, dear friends. And if you guys remember that we had Mr. Maluk join us somewhere earlier last year in one of our episodes of the podcast, where he did share some fantastic insights about the remission related twin health work that they're doing. And I think many congratulations to Dr. Joshi for that fantastic research that he's doing. And we will continue to watch that space. So we'll wait for Dr. Joshi to get back to us. Maybe there's a technical glitch. But going back to that point with Dr. Joshi was making, Dr. Jothydev, is only 7% of the data gets captured in our country. And I remember you just shared with us earlier that you are working on a project that involves incorporating AI into the electronic medical records and electronic health records. My question to you is, how important is data interoperability in terms of integrating AI into the electronic medical records? And if at all, we do see a success in this space, maybe in the next 2 and 3 years or 5 years, how do you see that changing the whole paradigm of clinical practice for physicians, diabetologists, or any clinicians for that matter?
Yeah, well, Dr. Shashank actually was commenting on the EMR status in India, how many doctors are using EMR. But before that, before answering your question, let me make a comment. Because Shashank just disappeared, and that is definitely because of power failure or something happened, the network issues. So this is how you identify a technology. So you identify that this is a technology, because technology invariably can fail. It can fail once, twice, or 3 times. But I always used to tell my doctors and my students, you should never be disappointed when a technology fails. When you're using AI in your practice, or when you're using CGM integrated with an AI, it can also fail. But that doesn't mean that it is not going to work. You should never get disappointed. And once you start using the AI, then you will suddenly realize the fact that this is somewhat far superior to what you used to be. So in the EMR, let me tell you that this is not easy. And when you're training the AI with the data sets, especially when you are into machine learning, that of course doesn't require any further programming, but every output depends upon the data sets which are used for training. So you have to train the AI with the data sets which you are really aiming for. So I think Shashankji has come back, so I will welcome back Shashankji. So would you like to complete the other one? And then I will, because he was
you continue because
you continue, sir. You continue.
Computer is got hung up here. So, we need an AI solution sometimes.
Yeah,
And I just showed that, it can be so challenging sometimes. I was just telling everybody the space in which we are trying to do RCT in this space. But I think Jyoti, you continue, and then I can continue my experience a little later.
Sure.
Hopefully, if this gets sorted, it'll be great. But I am very much there. So see, look, technology also allows you to reconnect. I can go back on my phone and again get connected. So those are advantages and disadvantages. And again, mobile phone comes to our rescue.
Absolutely. That is the magic of technology.
Yes.
It can fail, but it will definitely work. Despite failures, it is definitely going to work. So when you are integrating AI with the EMR, the first step will be to identify what all criteria you are looking for. Are you looking for a prediction? Are you looking for early recognition of some complications? For example, I would like to go through the hemoglobin pattern of my patients because I have EMR for more than 20 years. I have data, more than 26 years. So if there is a subtle change in the hemoglobin, probably can predict some chronic kidney disease or even malignancy. And with the human eye, if I am trying to go through every pattern separately, what is happening with EGFR, what is happening with hemoglobin, what is happening with the LDL cholesterol levels, what is happening with the cancer markers such as CA19-9, then it is humanly impossible. And with the computer programming also, if I am doing it, that also comes with huge data. Then again, I need to analyze. So that is where the so-called large language models should definitely replace the conventional AI models and algorithm in diabetes care, in diabetes screening, in prevention, in education, in empowerment, and of course in precision diabetology and personalized diabetes management. Because diabetes care can be transformed only when you are focusing on precision diabetology and personalized diabetes management, which we are nowadays trying to do, of course, with the help of AI, but the role of AI is only less than 5% nowadays. But in the near future, it should be more than 50 to 60% AI taking over, when the outcomes will be far, far superior. But despite all the advantages and the merits that we are discussing about AI, it will have multiple limitations and challenges with respect to inadequacies, inconsistencies. When you are reviewing a paper or when you are trying to interpret a chart with ChatGPT-4, then you might get a review paper. You can even write a good, we were discussing about a review last time when we met.
Yes.
We were having a long discussion in Egypt, I remember that. But ultimately, because day before yesterday, there was a recommendation written with the help of an AI, and I was reviewing the paper. And there were gross errors which has crept into the paper. So human interference is absolutely essential. As Shashank ji said in the beginning, AI is never going to replace doctors, but AI will do the administrative task. AI will do the job where the doctor is forced to do, where the doctor's job is actually not required for that. Apart from the job of sometimes the radiology or pathology, AI is doing a job where the doctors can reduce the errors. And that is where the AI is going to rescue the doctors. If you look at the top 10 reasons for death, including the United States, the third commonest reason for death is medical errors. And it is still medical errors. And if that is the third reason, with AI, it will become the 10th reason. Of course, it cannot completely vanish, but it will minimize the errors in medical practice. So anyway, thank you very much, Dr. Shashank ji. With the help of AI, he's back.
Yeah, so I think that is so very important, and I'll just take one point out of this whole scenario that happened. Is that's why we call it augmented intelligence. So you have artificial intelligence. We need to use our human intelligence to tame that artificial intelligence in the right way, and then use it as an augmented intelligence. And if it goes wrong, like Dr. Jothydev said, sometimes we need to supersede and adapt to the circumstances, exactly like what Dr. Joshi did. He joined back straight away from his mobile phone, and now he's back again in his usual thing. So, Dr. Joshi, I'm going to let you finish on what you said, regarding the remission. And I was also highlighting that we had Mr. Maluk joining us, and that space of remission is a fantastic space that you're working on, and with the help of the Twin Health team. And many congratulations to you for that. And we will be watching out that space for all the developments that's happening. But we'll let you finish that comment that you were making.
So one more thing, why did this mishap happen? I was trying to put the background.
Right.
And when I was trying to put the background, because I realized that I have an odd background out, okay, I clicked the wrong click and everything got hung. So that's what happened. And AI told me, this is what I did. And this is the error which I did. So they said, switch off the computer and reboot it again. And don't try it till the program is over. So that is what. So I think you are very right. I think in the remission space, AI is going to revolutionize the space. I even feel the CGM will be a revolution. Right now, rate limiting step for a lot of remission programs today is when you monitor, you receive. And both Jyoti and me work into technology, and we are both tech avid enthusiasts. But the tech world is cluttered. Amit, tech world is cluttered because in the doctor space, we don't have advanced learners and people who really want to do the tech space in a big way, because there is a huge space which still needs education, and they are allergic to many of these innovations. So I think there are skeptics, there are conservatives, there are pragmatists, there are visionaries, and then there are tech enthusiasts. So me, you, Jothydev are all tech enthusiasts which love to see, and we are probably in the innovation space. We want the newest things, and the younger generation is very much there. But most people right now are pragmatists, and they want to see the entire product solution with evidence base. And that segment is growing very fast. And that is where companies like Twin Health, we need 100 such companies in India.
Sure.
Which are in the startup space or in the regular space, to deliver us solutions in each of the platforms and domain in which you operate, whether it is clinical care delivery, whether it is education, whether it is hospital management. And if we just take up one space, which is diabetes, which is our domain, okay, or weight loss, which is another domain, we can actually focus on it and get results. For example, in weight loss, we have medications. In weight loss, we have lifestyle. And in weight loss, we have a lot of other devices and surgeries. Who needs it? How to put that filter? AI filter is a very good sorter in an evidence-based way to tell you that this person may do well, probably for this phenotype with maybe a bariatric surgery. A brittle diabetic, BMI more than 45, not able to comply to drugs or diet or lifestyle, has gone through a yo-yo phenomenon, maybe a reasonable option to go through a bariatric surgery. But somebody is 28, 29, is on a couple of medications, is tech savvy, is reasonably compliant on applications or digital apps, can recognize and make a change, may go through a remission program. So I think identifying people who will adapt and use technology is equally important. Also, there are a lot of enthusiastic caregivers. For example, I have a lot of geriatric patients whose grandmothers and grandfathers are looked after by their grandchildren who are technologically very savvy. And they are able to use the tools of AI, which you, me, or Jyoti give in our clinics, to get a A1C which is normal, without hypoglycemia, without fear. I think the fear of technology is very large, and the clutter in the space is very high. Decluttering the space and overcoming fear is the prime two learnings which I learned from Twin Health and RCTs which you do. Final point on research. I think research and innovation is here to stay. What we listen, we learn. What we learn, we adapt. What does AI do? It allows and fast tracks the curve from listening to learning to adaptation.
So
this fast tracking is the key for better outcome, because we have only one goal. Our goal is out of people living around us who have diseases or pre-diseases and make them healthy and happy. The other important thing of AI is the behavioral change AI does is dramatic. AI is also having confidentiality and anonymization. So I see a lot of people with mental health problems. And one of the reasons of success of companies like Twin Health is that people are not just happy because they got a good number and they were able to get a 5.7, but they were also happy. They were able to make that change. They got that communication platform. They thought somebody was caring for them 24/7. They were being monitored 24/7. And that gives you a comfort to sleep. So it's very important that AI is a very good tool to know that somebody is watching it on you 24/7. Somebody is there like a mother or a father from a healthcare perspective, taking care of you, and is there at a drop of a call. So I think that's very important. So the coach or the device and the alarm from the device, some people feel it's an irritant, but actually it is a corrector for a better outcome. And therefore, I don't call it as an irritant. I call it as a nudge. I call it as a healthy nudge for a change. And I think change is here to stay. So I think, we are in best of times, as Charles Dickens said, though we are in worst of times. And we must know how to optimize and fast track the listen, love, adapt curve.
So true. I think you just mentioned about what we were just discussing before you joined us about just-in-time timely intervention that brings a lot of behavioral change and improvement in the outcome. But very important points you made there, Dr. Joshi. Dr. Jothydev, I'm going to go back to you with a question, taking a lead from what Dr. Joshi said, that there is a clutter in the technology world, and healthcare professionals are curious. So, and we know we need a very important collaboration between the tech world and the medical world to properly implement AI in the right medical space. Because at the moment we are often seeing tech enthusiasts bringing out a solution that is quite not solving the need gap, while there are medical enthusiasts, medical tech enthusiasts who are trying to build a solution or who are trying to close this need gap with a technology and AI solution, but they're not finding a right tech partner. As one person who have worked with the industry, who advocated the use of insulin pumps, which also involved a lot of tech and medical professionals collaboration. Dr. Jothydev, how do you see this space of collaboration happening in the next 5 to 10 years? I literally say it is a marriage between an engineer and a doctor. How do you see that happening, and how do you see this ecosystem evolving?
Well, Dr. Shashank Ji was discussing about the fear.
Yeah.
And the fear of the doctors using an AI.
Yeah, I got my correction done.
Yeah, the solution is there.
This is how I still took a chance and I did the correction, though I knew I would crash because you were talking.
And the fear of a doctor, and that is very important. Dr. Shashank Ji was discussing about the fear of doctors using the technology, and this fear will go away when the doctor is partnering with engineers. So that is the only solution. So when we are discussing with engineers, we know that engineers probably doesn't know anything about medicine.
True.
And the same with most of the doctors. We don't know anything about technology. So when we sit and when we discuss, because I still remember it was in 1997 when I realized that I cannot manage diabetes. Though there are some guidelines, of course, the similar guidelines were not existent at those times. We cannot do what it is recommended. And we cannot do the glucose. And if a person is monitoring the glucose and coming back to me after 3 months, I cannot do anything. So I sat with a techno-savvy person, an engineer, and we together created an EMR which is specific and customized for telemedicine. So this sort of a partnership is absolutely required. And we, the doctors who know what need to be done, because we know that certain doctors who are into technology, we have already realized the existing gaps, huge number of patients, the consultation time, so many things to do, but we cannot implement all of them. and many things are being missed during a consultation. And despite repeated training, reinforcement, and advices to the patients, they are not probably following the instructions. And despite advising a mobile health platform with all these automated boards and other coaching available, after 3 months or 6 months, most of them are probably discontinuing the therapy. They are going to another doctor. And despite all the innovations, people still developing the complications.
Yes.
More and more people developing the disease. So these gaps need to be discussed with the engineers, the so-called engineers, and we need to explore solutions with the help of technologies and with the help of AI. And let me repeat, the results depend on the training data sets. So that is not easy. So I have realized with my work that I am doing that we need to train the AI with the appropriate data sets, and then only the output can be optimized. And the good aspect of AI is you can keep on training and it keeps on improving. So with 780G, Shashank was discussing, and Dr. Amit also was discussing with 780G. 780G is having an AI integration, but that is only a basic AI. So over a period of 1 month, it improves, and many patients can reach a time in range of more than 80%. But still there is a gap. Still there is a huge gap. And with technology now, we are able to probably completely devoid of hyperglycemia. So we have averted the fear of hyperglycemia with the help of the newer CGMs and AID, but the residual risk of hyperglycemia is still there. So we are probably fast advancing and rapid strides in the developments. And the next stage in development depends upon how we do a homework. We need to have a similar survey, and we need to collect the data from many doctors who are successful practitioners, not only researchers, and find out the gaps. And these gaps can be different in a rural practice versus a urban practice. And we need to find out what are the reasons for success, the success mantras with those doctors who are probably having most of their patients reaching their targets and able to prevent the complications. And try to work on replicable models, and then work on the same models, power it with AI. And that is how probably we can prolong the longevity and improve the quality of life. But at the end of the day, I will say that we need to reduce the cost. We need to reduce the cost of the existing technologies with the help of AI. I am so happy, Dr. Amit, that when you're traveling, at the recent ADA, I listened to 2 lectures on retinal cameras and AI. And we have been using it for more than 8 years. So
Yes.
I believe that in India, we are far advanced when compared to many other countries with respect to artificial intelligence in healthcare.
I think I'll completely echo with you on that, and I strongly feel that as a country we will evolve much faster than the rest of the globe, because we are much fast in adapting to the changing circumstances. Whether call it we saw how Indians adapted to the UPI method of payment, and how we have progressed so quickly. So I think we will be adopting fast. But I think that is a very important point you made there, Dr. Jothydev, that this collaboration is important. And that has been one of our primary mission and vision of Doctors AI, where we are trying to foster an environment where the right medical professional can find a right tech partner to set forward his ideas, his thought processes, and understand the need gap and find the right tech solution. And I think as a country, with the guidance of with both of you and many others senior clinicians, we will be going and marching forward with this collaboration. Dr. Joshi, I will come back to you with a very important question, and I think this is a question from many. As a professor, as a person having a strong voice in the policy making of at least the healthcare policy making in the country, how important it is that medical professionals are trained on the basics of AI, and how do you suggest the steps be taken to incorporate that into the regular medical education curriculum? What's your thought and views on that?
That's already happening.
Right.
First step, Government of India needs to be congratulated for that. And Ministry of Health and Family Welfare are first coming with some regulations. We have NMC now in place. And you will see that both in undergraduate and postgraduate medical curricula, we are already using a lot of AI right from our competitive exams. You know that right now NEET and NTA is under controversy. But their entire NTA backbone is based on biometrics and AI engines. And is highly anonymized. Of course, it is, and it is almost fail-proof. So I think it's very important that undergraduate, postgraduate medical education has a specialization where teaching is done on various aspects of tapping various healthcare-related AI. But it's work in progress. It's rapidly evolving, and technology changing very rapidly. The second space where government has taken a major leap, which will occur very soon, just like you have a Digi Yatra and you have a digital Aadhaar card, you will get a digital healthcare Aadhaar card. That's working in progress. It's a beta version which is being field tested across, and you will have AI assistants for remote rural medicine. So for remote access or rural medicine, you will see a lot of AI nursing health or healthcare assistants being delivering healthcare delivery. So I think it's very much there. But I completely echo your sentiment that this is work in progress. And a digital health curriculum, a digital health module, and a digital healthcare delivery as a part of undergraduate medical teaching and as a part of postgraduate medical spacing, which is specialty specific, is a need of the hour. For which, what is the key? Key standardization. Because whenever we come on any therapy space or any domain space, we need standardization. And because we are work in progress, the standards have to be set. And I think that is also something for our policymakers. But one thing is there, we have been one step ahead of that. For example, in COVID, we had the COVID platform. It is the first of its kind in the world. And I think it was pretty innovative in the healthcare space. Because COVID was a perfect platform for vaccination. Similarly, just like we have now a Digiyatra, and now we'll have a digital healthcare card. So I think it's work in progress. It's a long way to go. But as you rightly said, that we are very proud Indians. We are at Viksit Bharat at 2047. I think India, which will be the digital leader on planet Earth. Because we are 1/8 of the world. We are 1.49 billion people. And I'm a very proud Indian, and so should all of us be. And I think in the digitalization space, we are definitely the brain power of the world, the IQ power of the world, the EQ power of the world. And I think in digital adaptation, just like mobile phone penetration, we will be one of those countries on planet Earth which will be the leader. So I think we should be very proud of it. And I'm certain that in times to come, the new MBBS students and the new MD/MS students will have digital health as a part of the subject, just like children are having. For example, notebooks are disappearing and iPads have replaced. And similarly, even when we were residents, we used to carry pocket books and we used to carry notes, which I still carry. But now everything is being replaced by a mobile phone or on an iPad. So things have changed, and we can see that transformation even now happening. But it will get a little more systematic. So two things for the policymakers. One is integrating and creating a syllabus for digital health and modules for digital health, and actually marking a space for it in the curriculum in various years of medical graduation and post-graduation. And second is setting standards for disease domains, or what is approvable and what is not approved. For example, I'll give you an example. When we buy a glucose meter, when we buy it, we need to see two things. One is a YSI plot, and second is the error grid analysis, and whether it is in zone A or not. So similarly, when we are looking at a digital delivery model, we will need to have some standards which are set. Just like for when you buy a fridge, you need an ISI mark. some standards will have to be set. And this is where, bodies which like you are developing, Amit, will have a major role to say in that space when all this curriculum is set. Right now, of course, as I said, we are in infancy. We are rapidly changing, but the infant to adult time is going to be rapid and fast.
So very true. I think it starts with being curious, and then you ask that question, how is this happening? I think that's how we all started our journey into learning something. And then we start learning, and then you start adopting to it, you start adapting to that change, and then it just becomes a journey. And I think it's been a journey for most of us working in this space of AI and tech. And I think this is how it's going to be for most of our clinical professionals and peer groups who are starting with AI. But we need to start asking that question. From that wow factor, we need to ask that how factor. How is this really working? Ask that question, and then we can get curious and start learning about it. But yes, learning about AI is going to be the key towards adoption of AI in healthcare. So we are almost at the end of our session, but before we let both of our esteemed guests go, we have a couple of questions which is here with us from some of our regular podcast viewers, and I'm going to ask one of such questions to each of you, Dr. Jothydev and Dr. Joshi. So the first question that I can see up on the screen is from Dr. Hitesh Saraugi. He's from Delhi, and he asks a very interesting question, Dr. Jothydev. How can a healthcare professional regulate the misuse of AI in healthcare? What's your take on that?
I think Dr. Hitesh is one person who would have a passion for technology and AI, but at the same time is having a fear. So his question is whether it is going to interfere with the doctor's job.
Yes.
I think you are the founder of MedAI, and I have a request. And Dr. Padmasri Shashank is also there, and he has been narrating all the possibilities of AI and how it is going to be regulated and how it is going to be taken up by the government of India. And I believe that you can be a leader for this in the healthcare and MedAI, and you can be leading some of these aspects, some of the key aspects, and answering to the question very precisely. When you are trying to implement an AI, it has to go through clinical trial. And that is probably a mandate. If you are using it in clinical practice, you have to make sure that the AI is going to give you the right decisions, especially if it is going to make a diagnosis, or if you are helping it with supporting you in the prescriptions, or in advising or guiding in some investigations. It has to go through clinical trial. And probably as a leader in technologies and as a leader in AI for global, we can do it in our country. Some of these innovations and the ideas and the concerns which come up as questions, a similar question, it can go through specifically in some of the well-designed randomized clinical trials to prove that this modality is going to provide you with better results and with better outcomes. Ultimately, let me tell you, AI has to make life easier for the doctors, and it should never result in probably taking away our time, because all the available technologies in one way or the other has resulted in more time spent for the doctor. So the AI, when it is integrated, you leaders should make sure that it is probably lessening the effort of the doctors, the burden of the doctors, and also helping the patients, because similar to the doctors, patients are also fearful using AI and technology. So the patient should also feel that, of course, the doctor will be there to supervise, to oversee, and make sure that it is in the right path. Thank you.
Fantastic. That is really a visionary statement, and I'm sure it will be taken well by the community and followed. Dr. Joshi, we have a question from Dr. Raghavendra. He's from Chennai, and he has a very interesting question to ask. That does the existing data infrastructure that we have at present in India, does it really allow the implementation of AI solution in Indian healthcare setups, or are we still not there yet?
Mr. Raghavendra, I think it depends on how you look at it. If you think that in the Indian healthcare setup, everybody should be sitting with a computer and digitally entering everything, and doing it like a hospital OPD, we are not there. And that ecosystem is there in the US and Europe because they are reimbursed countries. So the reimbursement community or the insurance company wants to see that data, and that is why it is there. It is not because, but there the healthcare delivery is slowed down by record keeping. Okay, that is something which we need to recognize very clearly. Having said that, I think our own tools of mobile, WhatsApp, so many other social medias, including Zoom, which we are using for this meeting, as well as emails, have changed and transformed it. So I think we are in between. We are work in progress. We are in a transition zone. And I'm certain that in times to come, we will see a change happening. We have a long way to go because you need a uniform healthcare input in the digital space. And then from that, we need continuity of care. And right now, this is work in progress. So I think I don't want to disappoint you. You can use AI through your mobile technology to see what best you can optimize it. But if you use a platform to record and then take it and cup it with an AI backbone, it will change and transform healthcare delivery. I feel all of us are using it. We were all enthusiasts. We were inquisitive, but we are not doing it as a hobby. We are doing it because it can improve the quality of life and it change outcomes. If you need better outcomes, you will have to stay in sync with the current adaptation of technologies. So people who won't adopt technologies will find it tough to maintain good outcomes. That doesn't mean that people who don't have technologies won't get outcomes. Yes, they can still get those outcomes, but the time span on that will be much larger. And you still need, as I said, a human touch in the loop. Without that, you can't do it. So you need that touch, you need that smile, you need that little human emotion. But I think AI is a fast tracker. I call AI as a fast tracker. I call AI is a precise tool. I call AI is a person which allows me a precision at a fast pace, but keeping the control with me. So I think I have a tool which I should know when to drive, and I should know when there is a green signal, when there is a yellow signal, when there is a red signal. And I think it is for doctors and healthcare workers to draw that Lakshman Rekha. So it is very important to recognize that I think AI has arrived in the healthcare space too, but in different disease domains and outcome domains, we will have to do lots of research, and we will be flooded with research in the next decade. By the time as India marches towards its century, I think we will have clear-cut algorithms and solutions in every domain. And I think we'll be a very proud nation. Because remember, to deliver healthcare to 1.48 plus billion people, a million plus doctors are not sufficient. They will need the aid and assistance of AI so that then only we can have excellent outcomes and we can keep a healthy nation. Because remember, health of a nation will determine the wealth of a nation.
Absolutely.
So it's very, very important to recognize that we have to adapt.
Very important points made there. And it all starts with data literacy, followed by AI literacy, adopting digital health records that can help you preserve the data and then implement that into algorithms. So yes, it is work in progress, dear friends. So we have come to the end of this, but before we let our guests go, one final comments, and I'm going to take a very important visionary point of view from both our esteemed guests, starting with Dr. Jothydev, followed by Dr. Joshi. And the question is, to both of you, we always envision a health for all in India. We always envision having equitable distribution of healthcare, state-of-the-art, standardized healthcare, both in the urban, semi-urban, and rural setting. Can AI, in the years to come, actually help us deliver, in true sense, equitable healthcare for all? Can we really see that day without any hindrance, without any limitations? Can it really be AI for all, health in healthcare, bringing equitable healthcare? Dr. Jothydev, followed by Dr. Joshi.
Dr. Amit, I would like to say yes to your question, but practically it is impossible.
Right.
Because there are so many other challenges, including the
Mhm.
cost of medications. But
Yes.
with AI, maybe equitable distribution of healthcare could be possible in more than 80% of the population. Now it is probably only in 20% of the population. But with large language models, if we can significantly reduce A1C, significantly reduce the burden, complications, my only request is don't delay adopting AI in practice. That fear should disappear, and the doctors should soon get convinced. And once it is established, we have to rapidly adopt it in healthcare. Then only the so-called optimal and the best outcomes can be accomplished. Thank you.
Dr. Joshi, your viewpoints on this?
I think it's here to stay. So 3 A's: access, adherence, and affordability. If you want access to health and disease, if you want it affordable, and if you want to adhere it long term, I think AI is the best enabler we have. And I think it's important that we adapt it, but we need to adapt it to the local need. We have to adapt it to what is available, and we have to adapt it in a way people are able to adhere to it. So the barriers are more right now, the fears are more, and the clutter is more. Our job has to be like Arjun's eye. We have to be focused on our outcome, and the outcome has to be affordable, accessible, and has to be long term. This is not a hype. This is a real-time solution for an outcome which can be modified. But for that, you need to be open, and you need to be science-driven and evidence-based, and not Google-driven or WhatsApp-based. We need to ensure that we are scientifically driven in an evidence-based way so that we can get affordable, accessible healthcare delivery which stays long-term. And it's not just like a one-time hype that I had an AI concern, ChatGPT gave me this solution. It is a solution which may give you a clue to your doctor to ultimately treat you. But it is not that ChatGPT solution on a complex case was computer telling you. It was only an aid to your doctor to manage you better. Ultimately, you still need that doctor around, and therefore don't fear it. Embrace it, whether you are a doctor or somebody who is taking medications or any other thing. But remember, we are all here to help. We are all here to care, and we are all here to share. And in that equation, we have to be equitable. We have to ensure that everyone gets it universally. And for universalization of healthcare, I think the cheapest source, if you ask me, is digital.
Fantastic. I think, dear friends, we had a lot of take-home messages coming in today, and I think a lot of thought processes and blocks in the mind of many of our peers have been cleared today, hearing from two of our most experienced clinicians, two of the most important technology men of the country in the field of medical science or healthcare. So while we come to the end of the session, I would like to extend a big thank you to both our esteemed guests, Dr. Jothydev Kesavdev and Dr. Shashank Joshi, Padma Shri Professor, for joining us in this 1 hour and 15 minutes conversation, and we had fantastic insights. So let's end on a positive note, taking from the messages of Dr. Joshi and Dr. Kesavdev. AI is here to stay. We need to be curious to learn. We need to adopt, and we need to keep on learning. And we must be inquisitive about the changes happening around us and use AI to its potential to augment our clinical performance so that one day, perhaps one day, we can talk about that universal healthcare and equitable distribution of health for all across the country. Thank you very much, dear guests, for joining in. It's been a pleasure it's been an honor for me to host you at the 24th episode of Med AI podcast, Decoding Health, AI in Healthcare. On this note, I would now hand it back to Hetvi. And once again, a big thanks to Hetvi and the MedSynapse platform for hosting us. Back to you, Hetvi.
Firstly, thank you so much to both the speakers for sharing your invaluable insight with us. And let me tell you that we have gained so much insights into how AI is shaping the future of India. And thanks, Dr. Amit, for being such a wonderful host as usual.
And also, I should invite all our viewers to join us in the next episode. There's going to be a Silver Jubilee 25th episode, and I'm going to have my co-host Deepu Patel joining us. So please join us on the 25th episode of the Med AI podcast series. Thank you.
Congrats.
Thank you. Thank you very much.
A big thank you to our engaging audience for engaging into such an important discussion today. And until next time, take care, and we will see you in the next episode celebrating 25th Silver Jubilee of Dr. Amit and Dr. Deepu.
Thank you.
Thank you.